we are going to be helping you today understand the No Surprise Act. And my name's Dr. Bowles. I'm the Chief Clinical Officer at Notes. And unfortunately, the No Surprise Act comes for as quite a surprise for many clinicians. And the terminology that they use in the act is somewhat convoluted. So we're going to help break down that act itself and some of the provisions to help you understand the bill. Um, Now, there were many departments in the government that were involved in this act, like the Department of Labor, HHS, the Treasury Department, the Office of Personal Management, and the bill itself was revised multiple times. And it wasn't until late 2021 before it actually passed. And that was in the last month of the year. And then it started on January 1st. So if you haven't heard of it before, do not be concerned, okay? You are not alone. Um, what the No Surprises Act is for is it's intended to protect consumers from unexpected medical bills. And many clinicians are unsure whether that applies to the services they provide. And the short answer is more than likely yes. And it's essential to understand why this new law has come to fruition and what you need to do to be in compliance with it. Now, typically, when a person with health insurance coverage seeks care from an out of network provider, their insurance does not cover the full out of network cost. And this results in higher costs to it, the individual. And many times it's difficult for the patient or client to determine what healthcare provider or hospital is in their network. And that's especially true in emergency situations, right? In an emergency situation, you are not concerned on whether that hospital is in network or not. So, unless the state law prohibits it, an out of network provider can usually bill the person for any difference between the bill charge and the amount paid by the health insurance. And it's important to understand that that is called balance billing, and it leaves many patients with a surprise bill. Now, just out of curiosity, you could type yes in the chat or no. How many of you have heard of balance billing before? So, how many of you have heard of balance billing before? So, we're getting some in the private. You can type in private or public. So either way, I've got a lot of no's, a lot of yeses. It's kind of a mixed bag, right? And so now, so we'll talk about balance billing a little bit more and definitely how that affects you. Now, these are some of the provisions of the No Surprise Act, but I'm only going to cover what's most important and the provisions that are most utilized. There's no need to get bogged down with all that legal jargon that this act has, and it most certainly has a lot of it. So again, a lot of people are asking, like, does this law apply to me? And these are the health organizations that must comply here. Now, in accordance with the regulation, healthcare expenses must be made known to a patient or client before they receive care. So, and this is about transparency in hospitals, urgent cares, primary cares, mental health, even ambulance air services. And all of these areas, including the air ambulance companies, will not be able to send patients surprise bills for amounts greater than the in network rate. So I'm not sure if you've ever seen a bill for an air ambulance like helicopter. When I first got out of nursing school, that I actually went to nursing school because I wanted to be a flight nurse. So and when I got out of nursing school, I did exactly what I was supposed to do. I worked in the emergency room, and I got some critical care experience, and that was a job that I wanted my entire life. And I actually did that job for only 6 months, and I had to leave because it was not at all what I thought it was going to be. Those helicopters are very, very small, very, very tight space, and those cool suits that you wear are waterproof for a reason. So, but basically the average cost for a helicopter is about $19,000. And that rose in just 1 year to $24,000. So this is kind of why this is in effect, because in healthcare, you can kind of charge whatever you want. And what's interesting about this law is it doesn't affect ground ambulances. So only air ambulances, just which is unfortunate because we know that the cost of getting an irregular ambulance is astronomical. So average cost around a regular ambulance is about $1,200, even for a few miles. And like I live in Charlotte, North Carolina, and if you don't pay your ambulance bill, they can put a lien on your home. Just some interesting information out there. So this is kind of all building the groundwork while So you can see why the law was actually established and why it came about, because there's a lot of things going on with healthcare companies. And let's talk about how common surprise medical bills are. In 2018, we found that 1 in 6 hospital visits or emergency room visits is followed by an unexpected medical bill. 65% of Americans, their top financial concern is medical expenses. 70% of Americans who had medical bills had to reduce their food expenditures in order to avoid bankruptcy. And 2/3 of all personal bankruptcies are due to medical bills. So 39% of Americans are more worried about medical bills than COVID-19, and 18% of Americans borrowed money to cover healthcare expenses. And there are 250,000 medical GoFundMe campaigns per year that go up. These numbers are pretty astounding, right? So when you think about like why did they create a law like this is the reason why. So um, now let's talk about client protections with health insurance. While we're going over this slide, I want you to think about you as a consumer of healthcare services. This is banning surprise bills for most emergency services, even if you get them out of network, even if you get them without approval beforehand, and it bans out of network cost sharing for most emergency and some non emergency services. And you can't be charged more than the in network cost sharing for these services. And banning out of network charges and balance bills for certain additional services, like, when you go in and maybe you need to be put under anesthesia or you get an x-ray or a CT scan like radiology, those things it also bans. And it requires that healthcare providers and facilities give you an easy to understand notice that explains the applicable billing protections. So, and especially who to contact if you have concerns that a provider, clinician, or facility has violated those protections. So that's one of the thing. And the initial paperwork that you're going to sign out will sign whenever you get healthcare treatment will have a form that covers this for all new patients. All right. So there's a lot. So if you're thinking in your mind, is that an additional form that I'm going to have to sign? Yes, it is. I'll go ahead and clear that up. Yes, it is. Now, let's talk about self-pay patients because they're a little bit different. If a patient doesn't have insurance or they pay for their own care, the law will compel you to provide them with a good faith estimate before treatment. And the good faith estimate must include projected costs for services that may be delivered by providers or facilities in addition to the principal item or service. Now let's break that down into regular speak. Okay. Um, that means that if you are a therapist, you are going to have a good faith estimate for your self-pay patients that will not only include that service that you're providing for the day, but how many different occasions or sessions they will need for treatment. And that's not easy to determine with everyone, right? That's not an easy number to determine, but it's a good faith estimate. And we'll talk a little bit more about that in detail. So, but from January 1st and December 31st, you're going to get a little bit of leeway because, again, they kind of like pushed out this law really quickly and people didn't have time. And so HHS, the Department of Health and Human Services, will use its enforcement discretion to figure out like, well, if I'm not, you're in this webinar right now, you're like, I haven't been giving my self-pay patients a good faith estimate. So am I going to be in trouble for that? No, not really. They're going to give people time to get acclimated to that. They're going to give people time to get acclimated and engaged in this treatment. So now one of the things, for self-pay patients, and it's not just self-pay, there are patients and clients that you have that may decide that they don't want to put their mental health treatment on their insurance coverage for whatever reason. There are folks out there that do that, and so it's self-pay patients, uninsured patients, or patients that are choosing not to use their insurance. Okay, so just to kind of clarify that. There's a lot of little caveats to this law, so I want to cover all basics of those. Now, what are patients or clients still responsible for? They are still responsible for deductibles and copays and in-network rates. And if you're doing out-of-network charges, they've got to be provided to the client 72 hours prior to treatment or service. So what the law is saying is, like, it's not that you can't treat people that are out of network. You just have to let them know how much in addition that they're going to be paying for your services, and you need to get that to them 72 hours before. So, and to be billed out of network services, they're going to have to provide consent. Basically, you're covering yourself by saying, yes, they knew that I was out of network and they agreed to pay those additional costs. Okay. Now, I know we have some good questions coming in. Robin is here as well. She is the director of sales, and she is going to be helping answer some of those questions in the chat. And I will go back and get those questions as well. And on top of that, we have a webinar coming up in just, I believe it's 2 days, that will go over specific questions for you. So you're welcome to join us as well. That's just going to be a question and answer session because everybody has a lot of questions. Um, so the fundamental principle here is going to be, it's when it's an out-of-network provider and you treat a client covered by commercial health insurance at in-network facilities, the provider can only collect the in-network sharing cost. So that means if you're a therapist and you work for a practice and they are in network, but your particular services are out of network, you can only bill for the in-network cost. And I think that's important to share. Okay. So unless you notify the client in advance and you get a written consent to balance bill. Okay. A written consent to balance bill. Tracy saying, if you evaluate the patient and decide they need weekly sessions, you give them the good faith estimate for the year, that will cause serious anxiety. Tracy, I completely agree with you. I understand why the law went into effect, but you're absolutely right. This is going to happen in all aspects of healthcare, not just mental health. If I decide that I need to go to a therapist and I just think, because we all like payments, right? In America, we love payments. We're not going to pay that full amount for the car. We're going to pay it in monthly installments. And I can stomach a monthly installment, right? I can stomach calling and saying, well, how much is a session going to be? Okay, I can do that session. But it will make people think twice, which is really unfortunate when you hand them that and say, you're going to need 10 sessions at $150 a session. That's going to be $1,500, and that will make people, I agree with you. Same thing with cardiac surgery. I absolutely agree with you. Absolutely agree with you. So there are really good aspects of this bill, but I don't know that people thought it out all the way through, you know. So I'll just say that. I'm not going to say anything else negative about the bill, but that is something of concern. Absolutely. So now, how does out-of-network provider, how do they receive payment in a non-emergency surprise billing? As I stated before, this is a convoluted process, and you're going to receive a copy of these slides, and you can use this as a guide. So you have your decision-making tree here. Okay. And so because everybody's situation is going to be a little bit different, so we wanted to spell it out exactly how that works, and you'll get a copy of this. All right. Absolutely. Okay. What if my state has a surprise billing law? There are many states that have surprise billing laws already. Like my state of North Carolina had something similar. So I spoke to a customer of ours in Ohio. They had a similar law in effect. When I said, well, you're going to need to provide these good faith estimates, they were like, oh, I've been doing that. So the No Surprises Act enhances, it does not replace the state surprise billing legislation. In addition to that, this legislation establishes a minimal degree of protection for customers against unexpected fees from out-of-network providers. So state surprise billing laws will apply so long as they offer healthcare consumers with at least the same degree of protection as the No Surprises Act. And if you're wondering, well, what is my state? Let's take a look at your state. Okay, let's take a look at your state. So these are everybody's states, as you can see here. So prior to the No Surprises Act, 33 states had implemented legislations to safeguard healthcare consumers from balance billing. However, the extent of those safeguards varies, as you can look from the map. And that's why in 2021 Congress passed that No Surprises Act to safeguard the vast majority of individuals who were basically vulnerable by this hodgepodge of state laws. So, all right. So now, because these laws are already in place in several different states, your state may have a dispute resolution process. And you're like, dispute resolution process? Yes, there is. There is a if consumers feel like they have a dispute, they can actually they can turn to somebody. And your state may operate its own patient provider dispute resolution process that determines appropriate payment rates for self-pay consumers. So if the Health and Human Services, let's say, determines your state process meets or exceeds the minimal requirements under the federal law, the patient provider dispute resolution process, they will defer to the state. Okay. And they won't accept such disputes into a federal process. But if your state has an all payer model agreement, or another state law that establishes payment rates for out of network providers and facilities, the cost sharing amount and the out of network payment rate will generally be determined by that all payer model agreement or other state law. Okay. Um, Now, there is something called the Independent Dispute Resolution Entity, and what happened with the ruling is it ensures that patients will be able to contest a charge if it's larger than they anticipated. And the contesting can be done through a third party called Independent Resolution Entities. Okay, Independent Dispute Resolution Entity, excuse me. And if the variance is over $400, then the individual can call an independent dispute resolution entity, and there is a fee that the customer must pay up front to get this dispute resolved. And originally I was told when I was learning all about the No Surprises Act that it was going to be a nominal fee, and I thought the fee was structured. Now, so what that means, if you're found to be in wrong as a clinician, you have to pay the fee. But if you're not wrong, the client has to pay the fee. And some of those fees appear to be a deterrent. And if you guys have ever been in any of my webinars before, we talked about the Cures Act or this surprise billing act, I will tell you exactly what the law says and how it's written out. We will talk a little bit about, like I did earlier, whether that law is the greatest or not. I'm very honest in that way, and I'm going to do that with this law as well. It was supposed to be a nominal fee, and let me show you why I think that fee is a deterrent. So if the variance is over $400, the patient can dispute the charges, meaning I give them a good faith estimate and I have that leadway of it being within $400. And if it's over that, they can dispute the charges. Now, I'll also go through with a good faith estimate. You can change that. Okay, if you change your billing rates, and we'll talk about that a little bit later. But this is a list of certified organizations, and these are their fees. So these are pretty hefty fees. I was told the fee was going to be under $250. That doesn't look like the case here. So when we talked about the states, right? And these are certified for all states in which the federal process applies. And these are some of the fees. So here's the thing, the patients have to pay that fee. They have to pay that fee. So like I'll use this one, Keystone here. If if the fee, I mean, if it's within $400, they've already got to pay a fee for $2 shy of that. All right. This one's $3 shy of the 400. This one's over the 400. And if they pay this fee and the independent dispute resolution finds in favor of the clinician, they're still out the $500 plus whatever they owe. Okay. So that's, again, in full transparency. So I do think that's going to be a deterrent. What are your thoughts when you see those charges? What are your thoughts? Does that look like a deterrent to you or not? And you could type in the chat. I'm always interested to get people's feedback. All right. Let's move on. So let's talk about the continuation of care. The No Surprises Act, it protects patients receiving ongoing treatment when their treating physician or their healthcare facility plan network status changes. Meaning, if there's you go out of network, maybe you as a clinician decide you don't want to be a network anymore. Maybe the insurance company decides that for you. So um, this this No Surprises Act protects individuals if there's a network status change, and they provide a 90-day transitional care period. So, and during that time period, health plans and insurers are required to restrict cost sharing to in-network providers. So again, it requires health plans and insurance to promptly inform specified participants when a physician or facility is dropped from the network due to the contract expired, or again, you as a clinician, you're like, Blue Cross Blue Shield is not paying me enough, I am not going to renew with them. It protects the patient during that period of time, and the notification advises plan members of their entitlement as a continuing care patient to decide to continue treatment from the terminated provider or facility for an extended period of time under the same coverage, the same terms, and the same conditions as before the termination. Okay. So, they have that kind of protects folks. Um, and let's talk about when that would help. Okay, so these protections apply to an individual who satisfies the definition of continuing care patient and gets services from an out-of-network provider or institution. All right, so if a plan or insurer terminates a contract um, with the continuing care patient's provider facility, the plan insurer must you've got to notify the patient who's a continuing care patient of the termination. Like, hey, I'm a therapist or I'm a psychiatrist and I am not taking that insurance anymore. And they have a right to continue receiving transitional care from you or that facility. All right. And that's for a 90-day period. And then you can ascertain that each patient receiving ongoing care has the chance to inform the plan or ensure the need of transitional care. Okay. So, and that means you permit the continuing care patient to decide to continue the same benefits on the same terms and the same coverage as would have been the case had the plan or coverage not been terminated. Okay. So, I do have some people saying they lost sound. Can people hear me? If you can hear me, just type yes in the chat. I just want to make sure. I agree with Sarah. It is a money-making industry. Absolutely. Absolutely.
I can hear you, October.
Okay. Thank you so much. I appreciate you, Robin. Thank you. Thank you. Okay. All right. All right. So now, again, that election period's got to be made. Thank you guys so much. That's got to be made of a period of 90 days. So that is the beginning of the day their plan or insurer informs them of the change of network status, or until the person no longer receives continued care. Okay. So in this case, the No Surprise Act stipulates that the treating clinician or the healthcare facility they must accept payment in full for things and services. If the termination has not happened, they have to continue to follow all the rules, the procedures, and the quality of standards imposed by the plan or insurer of the individual. Meaning you can't give them less care. Okay. And that's a lot of CMS jumble that you see on the screen. So I'm going to break it down in the real world process. Let's say that Joan is a 30-year-old female. Okay. She's insured through her employee. And Joan is 30 weeks pregnant and she's following up with her obstetrician regularly. And on her next visit, Joan is told that her OBGYN no longer maintains a contract with her insurer due to that OBGYN voluntarily not renewing her contract. Would the continuality of care protections apply to Joan with her OBGYN? Danita said yes. Danita, you're right. Yes, they would apply to Joan with the respect to the OBGYN. As the contract between the obstetrician and the plan was terminated, reasons for other than failure to meet quality standards or for fraud. Okay, that's a reason you can sometimes insurers will they will cancel your contract. If it's due to fraud, they will cancel the contract if some of the provider or clinician's not giving quality care. So, but in the scenario where the contract is terminated due to failure to meet those quality standards, those care protections wouldn't apply. So, but let's break that down. If you're not giving good care, you have more to worry about than whether insurance is going to continue to charge you in network or out of network. That's the truth. So, but in the example with Joan, she's 30 weeks pregnant, and her OBGYN decided to terminate her contract with that insurance company. Joan meets the standard of continuing care because she's pregnant and she's undergoing treatment for the pregnancy with that OBGYN. And as a result, she is eligible for continuing of care protections because she's receiving covered services from that treating provider who has since been terminated from her plan's network. I hope that makes sense. I tried to break it down in those terms. I hope that makes sense. Again, it's a lot of legal jargon, but now let's talk about the good faith estimate form. These are all the things that you see on the screen that need to be on the good faith estimate form, and it is a cumbersome document. Not only does all this information need to be provided to the client, you must keep copies of it in your electronic medical record or in your paper chart. Now, I'm going to poll people right now. Do you use an EMR or are you paper charting? All right, so I'm going to do that poll there. So do you use an EMR or are you paper charting? Now, one thing I'm going to say is if you're paper charting, this is going to be really difficult because you're going to have to put it's not like an informed consent where you just hand them the informed consent, they sign it and they date it and they hand it back to you because nothing on that informed consent changes. There are a lot of things on here. You've got to put their name on there, you've got to put their date of birth, you've got to get their estimate. It's encouraged that you put your billing codes on there, the provider name, the provider NPI, which is if you're working at a bigger practice, that's someone is going to have to field all that, the service location and disclaimer information. I have, just out of curiosity, I like to tell people the results of the poll. I have 82% of people that are using an EMR and 18% of people that are paper charting. So, all right. All right. Now, let me give me just a second. Lost my speaker notes. Need those. Okay. All right. Keeping compliant. So this is what you have to do. You are going to have to ask the clients about their insurance coverage, and you're going to need to verify that information. Okay. Now, asking them and getting an insurance card, that's verification, right? But and verifying insurance can be difficult because people get insurance and lose insurance all the time. So, but at least you ask them whether they have insurance or not. And at the moment, as of right now, you're only required to offer good faith estimates to self-pay clients, those without insurance or those who are not seeking reimbursement for the insurance. Therefore, you're going to inquire if each client has insurance and whether they plan to utilize it. So, and if one of those questions is no, I don't have insurance or I'm not going to utilize it, then they need a good faith estimates. So estimates are not going to be required for consumers that are registered in governmental health insurance plans like Medicare, Medicaid, TRICARE, Indian Health Services. I'm trying to think of more Veteran Affairs, because those programs already have restrictions that prohibit balance billing in those programs. Okay. Now, you can provide a good faith estimate in electronic format. You can do it via the patient portal or you can do it via paper. So if you're one of those people that said I paper chart, don't worry. You can use paper, all right, for that. So and the estimate needs to be easy to read and in an understandable format. Okay. Now, this is just my advice. because you don't want a patient or client to come back and say, well, I didn't know about their fees. I had no idea they were going to charge me this much money. If you have a website, you can post your fees on the website, for example. Some practices are posting their fees in the reception area or even in individual patient care areas. You could then ask your patient if they've seen your fee schedule and confirm that with them verbally and document that. And according to the mandate, if they meet criteria, you should provide a written good faith estimate of charges as well. So now remember, HHS isn't, they're not going to start coming after people in the first year. They have the option to, though. So it is in your best interest to follow the rules. But as of the end of this year, they are going to start really regulating this. Okay. The law's in effect now. So it's kind of like a stop sign. I can stop for 3 seconds and maybe get away for that. Or if there's a police officer behind me, I'm stopping for 20 seconds. So, but they have the right to pull you over at any time, right? That's kind of the poor example, but one of the examples. So, but the key to all of this is keeping your fees transparent. So if someone ever does contact an organization, said, I wasn't aware of their fees, I had no idea they were so expensive, you can in turn say, well, we have our fees posted on our website, we have them in our reception area, we have them in the individual care areas, and I asked them how they were going to be paying, and they confirmed based on what they said, I did this or that. And I verbally confirmed with them their insurance, and I documented that. So, and if they're entitled to receive a good faith estimate, say I gave them that as well, and I have a copy of it and it's in their chart. Okay. So that's one of the good things. Now, how do you present the good faith estimate? It does need to be in a separate form. Now, clinicians, you guys are all too familiar with the HIPAA notification that had to be provided to patients prior to service. The good faith estimate has to be provided in the same manner. If they're self-pay, if they're non-insured, or they're not going to utilize insurance, you've got to give them a good faith estimate. And the information, as we looked at, should be personalized. That's the law. Such as that's not like an ICANOTE suggestion, that is the law. So patient identifiers have to be on there, clinician identifiers need to be on there, and billing rates. So, and a customer or client or patient should receive a new list every year, especially if you've had rate changes. So now in the form, verbiage should be added to protect your practice, stating that the estimates are guidelines and they may result in variances of actual cost or services. That absolutely needs to be in your form. Okay. And if the variance is over $400, the patient, again, remember they have the right to dispute the charges. So you've got to include information regarding the independent dispute resolution entities. And you should also state that any additional services that you may recommend, like ECT, TMS, crisis appointments, those aren't included on the good faith estimate. So you don't provide a buffet type service, right? It's a la carte. Okay. And so that needs to be very clear on that good faith estimate form. And most importantly, the patients need to understand that getting an estimate doesn't bind them to receive any of the services specified. The information is simply to inform them that these are possible charges should they seek to receive care from your practice. There's nothing binding in this. And private question, no, good faith estimates, it is not required by law that they are signed. It's just required that you give it to them. They don't even have to sign it. Okay, they don't have to sign it. That's not in the law that they have to sign it. So we're going to talk about what that looks like in ICANOTES, because ICANOTES has good faith estimates and they're easy to use. Okay, so let's check out ICANOTES a little bit. We have actually a couple of good faith estimates in ICANOTES. So let me show you these. One is a good faith estimate because we've created it to make it easy for you, because you saw all that information that needed to be pulled in. So there's two types of good faith estimates. Some people don't want to put all their billing rates on the estimate. You should. You absolutely should, but some people don't want to do that. So the good faith estimate is like, this is what it looks like. It explains about your mental care and medical care and how that's going to cost you. It puts the today's date in there. It's the patient's full name, their date of birth, their unique medical record number, and diagnosis. And notice it says in parentheses, if available. And so I'll drop all this information in, and then it will give you their diagnosis there if they're already there. Some of you are not going to have diagnosis, but you haven't seen the patient yet, so you don't know what their diagnosis is going to be, and that's okay. And then you can come in here and drop in the primary service that's or item requested. That could be therapy or counseling sessions. Okay, so I could type that in, and then I could put their primary diagnosis. So I could put like GAD, and then I could put their primary diagnosis code. All right. So, and again, I'm pulling it right from there. Question: can I use DSM-5 codes? It's probably going to be best to use ICD-10 codes because that's what you're billing on. So, and then you could come in, you could drop in the provider name, and then you could put in the estimated cost. Now, what if in your office they're going to be seeing a prescriber? So I know that they're going to have 3 appointments with my prescriber, and that's going to be 250 each. That's what I estimate for the year. And then they're also going to be getting therapy sessions, and I could estimate the cost of those. All right. And this is a lot of manual entry. We have another form that's not like this. So, but I want to show you. But I'm throwing out round numbers here to make it easy. But they're going to be seeing Janina for therapy. She's charging $100 a session, and I think they're going to need 10 sessions. Then Iconos is automatically going to calculate that as their total estimated cost. We've got the disclaimer here. So you've already got the disclaimer, and then I can simply compile that, and that's going to go into the patient's chart, and I can absolutely print that out. So I can print that form, and then I can go to the chart face, and there's the good faith estimate. It's been saved as a PDF, and I can print that out for Mr. Raymond Reddington. Okay, so there he is. And so he's got a good faith estimate. So Raymond can't come back to me and say he didn't know anything about the cost because he has the cost there. Okay, so that's Raymond. But bonus points if you know who this guy is. It's a good binge watching show. But it's going to be in the forms assessments of the patient's chart. Okay, the forms and assessments. Thank you, Robin. I see you down in there. All right, excellent. So now we also have, because the law says that you should include your billing rates, okay? So the law says you should include your billing rates. So what we have is, let me go into Bunny Rabbit. So here's Bunny Rabbit. And let's go into forms and assessments. Now this is every form ever created. So, but we're going to go to good faith estimates. Excuse me. Just obviously scrolling way past. So there is, what I just showed you was a good faith estimate. Now this is a good faith estimate with rates. All right. So if I go to the good faith estimate with rates, I can create a custom form. It's going to have Bunny Rabbit here, all their information, their unique ID number, their patient address, their patient list, and then I could go through. We still have the same things there. Okay, so I can put in the primary service, the primary diagnosis code. So Bunny Rabbit, he's scared of blood, right? So I can go in here and drop in that code if you had seen him before. Okay. And then I still have that information there with the estimated cost, the provider's name that will do that. But then I also have billing rates that will drop in for Bunny Rabbit. Okay, I have billing rates that will drop in for Bunny Rabbit. Give me just a second. Let's delete this note. Let me show those billing rates pop back up. So sorry about that. Go ahead and make sure. So iCanotes will automatically drop in your billing rates. iCanotes will automatically drop in your billing rates into the form. So let me zoom back in so you could see that. Forms and assessments. So sorry here. Good faith. I'll create the custom form here. It'll go in here, drop all of this in here, and then let me show you the trick. So this is going to be the provider name. Once I drop in my provider name, obviously this is our play account. So we have a lot of provider names there, and I can't remember which one. Let's see if that did it though. Yep. So it will drop in all of my procedure codes. Okay. So all of my procedure codes. Now, from the date of the good estimated, the estimated cost will remain valid for 12 months. It does, now that is part of this, okay, will remain valid for 12 months. However, if you want to change your billing rates, you can do that, but you just got to give them new forms, okay? And again, iKnotes will pull in all of your billing rates here, and then I can grab those codes and stick them in. So much quicker process. Your billing rate should be included on the form. Again, this is about all of our documentation in healthcare, right? We're all kind of practicing defensive medicine. And so this is a documentation to protect you, okay? Now, somebody asked, what about the lines? All these lines are there when you compile the note, though these lines go away. This is so I could drop all of the rates in here. One of the great things is you are going to get to pick the clinician. So if you're a front office staff, this is like a dream come true for you, because this process, unfortunately, it's a law. It's going to be cumbersome, but I can pick the provider that's going to be taking care of the patient, or multiple providers that will drop in all those billing rates. So what the law is made to do is to become more transparent about care, more transparent about care. So, all right, we have some questions here. Looks like, yep, Robin is answering questions. So let me just roll back up. Harold asked about continuing care. Yes. So let's say, Harold, that you're like, you know what? Blue Cross Blue Shield is just not, I keep picking on Blue Cross Blue Shield today, but I mean, you could pick any of them, right? And say, they are not paying me enough. I am not going to be continuing with their clients. I'm not going to be in network with them anymore. And you could drop Blue Cross Blue Shield. That's fine. You have the right to do that as a clinician, right? But if you have somebody, if they keep seeing you, like they want to keep seeing you, you're going to have to charge them that in-network rate. Meaning they're out of network now, right? Blue Cross is out of network for you, but you're going to need to keep charging them that in-network rate for Blue Cross Blue Shield, just for 90 days. 90 days gives them time to find somebody else in network. If they want to keep seeing you, great, but 90 days gives them enough period to transition out to somebody else who is in network with them. So, Phyllis says, does iKnotes have the templates? Yes. What if they're, Tracy, good question. What if they're self-pay and then submit that to their insurance? They are not supposed these good faith estimates are not to be submitted to insurance. That is a super bill, right? This good faith estimate is not to be submitted to insurance. Okay. So absolutely. That is not, yes, that's a really good question.
I think she was trying to figure out how to prepare that estimate if the patient is out of network, but they're submitting, so if she's got to charge or verify what they would pay through insurance if she were in network, or she can just give her regular rates if they're self-pay, but filing with insurance later.
Oh, no, that makes sense. Okay. No, I understand that makes sense. Thank you, Robin, for clarifying that. So yes. Now if they're going to be receiving services from you and they are out of network, and we will be putting those forms into iKnotes as well for the out of network forms, just it's going to be a generic form. These forms that we put into iKnotes now, these come straight from like HHS CMS, and so we made sure we followed their guidelines to a T. So good questions. And there are multiple templates out there, and I'm going to send you slides, and they'll have some templates in there that you can use. So let's see. Forms. So Robin, thank you. Covered in the forms and assessment area. That is where you're going to find these forms at within iKnotes, and the forms and assessments are in each patient's chart. So in every patient's chart, and all of their information will pull into the forms. You do not have to do that. So you don't have to do that. Let's see. Martha says, what if the sessions are less than the estimate? That that's fine. If the sessions are less than an estimate, I would give your normal rates though. Meaning I wouldn't upcharge and then like, I wouldn't do that. I wouldn't do that. So now the law doesn't specifically cover that. So it doesn't. I always find within these laws when they write them, they cover just like kind of the amount that they want to cover, but it's not all the basics. And so that wasn't covered in there. Jillian says, what if you provide a sliding scale? How do you put in your billing rates? So here's the great thing. If your normal fee, I'm just going to say, is $200, then that's what I want you to put on there. But if you decide to do a sliding scale or you decide to give them a discount, that's out of the goodness of your heart, right? And you can absolutely, in demographics under insurance information, you can put the amount of the discount that they're receiving. That will not affect the billing rates that you display though, right? That is what you are doing to be kind and nice, right? So, absolutely. So that's a good question. Phyllis, what if the visits are more than the estimated rate for the year? Here's the thing. What I would do is, like, maybe you think they need 10 visits and then you get in there and they're going to need way more than 10 visits, right? Then you just give them another good faith estimate. You give them another good faith estimate, and if there are things that you want to do in iCanotes that will help you remember, I can set up reminders to email me I can set up a reminder to email me at a certain date or certain time. I can even come in here. Some people are using the managed care authorizations, even though people are self-pay, and saying, listen, and they're putting in like a generic authorization, like 111, and is authorized by me, and they're adding it to chart reminders, and then they're actually putting in like the date that is issued and then the alert threshold. So you can say like it expires after maybe you could go in to a certain date, or and you would actually put in sessions, like maybe the authorized 10 sessions. And I want to start getting alerts when we get to that 8 session, even though they're self-pay, right? I need to know in 8 sessions in, or do we need 2 more? And if not, I need to get them another good faith estimate out there. So you can do that. You could give them multiple good faith estimates, because honestly, before you see the patient, you're not going to know kind of how much you're going to need to get in with them, right? As far as, you don't know if they need 10 sessions. You could say the general is 10 sessions, or some people say 6 sessions, but that person may need 30 sessions. So, and that's completely understandable. Yes, Harold.
October.
Uh-huh.
Melinda was asking whether, just for clarification, whether this needs to be provided before services are started or can be provided after the initial assessment.
No, that's a good point. So this needs to be provided before services are started. But there are a lot of therapists out there that really need to meet with the client to make sure that that you can establish good rapport, that it's just a good fit. And if you are one of those folks, you can just say, my initial consultation fee, or my initial fee is this, and then if it is a good fit for you, then you can then hand them another good faith estimate. I think I think that that's totally warranted, and would be fine. So, and you can definitely speak to that. This has always been my practice. I have always made sure that I'm a good fit for the client, and they're a good fit for me, right? Mainly that you're a good fit for them, right? So great questions here. Great questions. Tracy says, we are a fee for service. How are we affected by the patient submitting? So when you say you're fee for service, are those self-pay patients? And this we also submit sometime as a courtesy. What then? So elaborate on that for me. To insurance. Okay, to insurance that you submit. Well, that's okay. You'll submit sometimes as a courtesy. If you're submitting to insurance, you if you're submitting to insurance as a
So
courtesy,
she's out of network. So she would be out of network and just filing it for reimbursement to the patient, it sounds like.
yeah. So if you're out of network, I might even turn on your mic, Tracy, to see if you don't mind explaining that a little bit more, because there's a couple more questions I need to ask in that. So let me. So if yes, okay, go. Let's see if I can get your mic turned on. I am trying to unblock your mic now. Did that do it? Oh, you don't have one. Okay, no wonder that wasn't working. All right. If they are out of network for you, then you are number one, if they're out of network, then you are going to want them to confirm that they know that they're out of network and there will be additional charges. That's the number one thing you need to do to cover. Okay. So Jillian says that if you could clarify, if I see someone at the discounted rate, should you still put in your full rate? I absolutely would. I absolutely would, because you are discounting for them, right? That's a courtesy that you're doing. Same with sliding scales. You're not required to, unless you have some kind of contract with the state, you're not required to do a sliding scale. Can the second GFE be for the rest of the year, or does it have to include the whole calendar year with past sessions included? No, Jim, that's a good question. If you give them a second good faith estimate, if you give them a second one, then you don't have to include the one from before, right? You do not have to include the one from before. But there are two things that I would do. I would, and in Icanotes, you can create your custom buttons, right? You can create custom buttons all throughout Icanotes. So I would go in to the therapy note and I would create your own little custom button in here. Yes, we'll be sending out a recording. Okay, great. So this is our old therapy note, but I would create a custom button here. Let me get to the new therapy note. I'm not sure why that's not on in this. We have multiple demo accounts and people are playing with all the group rules in the background, so I apologize for that. But I would create a custom button, and let me show you exactly how to do that in Icanotes. So I would create right over here a custom button, and I would call it, the good faith estimate, and I would drop their name in there. And I would even kind of elaborate, that they reviewed charges or whatever you want to put in there, and agrees to the good faith estimate, whatever you need to do. And I would have that in here as my little button, and I would highlight that button. I'd hit continue. And the first time I saw them, I would put that right in there. Miss Rabbit received a good faith estimate and agrees to the good faith estimate. So it is in your documentation. Not only have that in the chart, but you verbally did that as well. Okay. So a lot of great questions today. Kimberly, yes, we are going to be resending. So there's two things. We took all the questions from last webinar that we had. I think there was like close to 600 people that had signed up for that one. We took all those questions. I mean, there are probably like 10 pages of questions. And we did like a frequently asked questions, because when you research data out there, there's not a lot of information. There's not a lot on good faith estimates. And again, it's a lot of jargon. And so I hope that today we were able to explain that a little bit more in detail, a little bit more in depth for you. So just out of curiosity, how many of you today are current iKnotes customers? I just wanted to throw that out there as far as polls. And yes, you can send a copy of the good faith estimate to the client via the portal, just like you can sign a copy. You could send a copy of the treatment plan to the portal for them as well. You know, you can send documentation to the portal for the client. Absolutely, you can. So, good questions. Good questions. All right. Well, listen, I want to be cognizant of everybody's time. Thank you so much, Jillian. It was a lot of information, and you guys had a lot of great questions. So thank you for joining us today. We are going to have a question and answer webinar coming up. And if you need anything, please do not hesitate to reach out to us. And thank you again. And a big appreciation to Stephanie. I really thank you, Stephanie, as well, for being a part of this.
Thank you. I'm so excited that you guys were able to be here today and help, everyone understand a little bit more about this big surprise act, which was a big surprise to all of us. So.
Absolutely. Absolutely. All right. Well, thank you so much. Y'all have a good day.
Thank you. Take care.